Good morning, Dorothy. Good afternoon. Woo, where am I being? Afternoon, Dorothy.
Hello, everyone.
Good afternoon. Everyone will be joining shortly. Hey, Anthony, I'm not sure if you're the one that's letting people in the meeting. I'm using the meeting check-in to log off the attendance.
Okay. Good afternoon, everyone. We will get started here momentarily. Ebony is running a few minutes behind and Colin is on his way in. So give us up to about 5 minutes to get everything going. We appreciate all of you being here and ready to start on time, but we do have more people coming in and we'll be getting started very shortly. Thank you so much.
Good afternoon.
Good afternoon, all. Once again, to all who are joining, thank you for being here. We will be starting momentarily. So give us about 2 to 3 more minutes and we will get started. While we prepare to start, I can see that we've added the sign-in sheet as well as the public comment request links in the chat. So if anybody here would, we encourage everybody to sign in, but if anybody has a public comment that has not previously requested to do so in this meeting, please complete that link.
And we are at quorum.
Thank you. Colin, Ebony is 5 minutes out, so she has invited you to get started when you're ready.
Right. Let's go ahead and start with with a welcome. Welcome, everybody. We'll go ahead and get started with a few announcements. The first one, and unfortunately, City Manager Page isn't able to join today's meeting, but as most of you know, she is retiring at the end of this month, and would like to wish her well and thank her for her service on the HSAC for the last few years. And she's been a great advocate for us and done a great job in the city manager's seat. And we wish her well in her retirement. So if anybody wants to say a few things, you're welcome to. These meetings are recorded, so she can always come back and take a look later when she has some time, but we do want to wish her well in her retirement. And Bo Ferguson is joining from the city manager's office on her behalf today. So welcome, Bo. I know you've attended a few meetings in the past as well, so welcome.
And I'll make sure to convey your well wishes to her. She's been handling a lot of responsibilities this week, and I know she regrets not being able to join for her last meeting, but I know this has been an important group for her to be a part of, and a responsibility that she took very seriously.
Thank you, Bo. And in case you weren't aware, Bo is the incoming city manager effective January 1st. So he is in the process of figuring out who will be filling city manager Page's seats. That is still to be determined. So we'll be working on that. So welcome, Bo, to your new position starting January 1st.
Thank you, Colin. There are many things I'm trying to figure out, but I will just start by saying how much I appreciate all the incredible partners and participants on this group. I've been very impressed with all of you in the experiences I've had so far, and the city looks forward to continuing to be a vocal participant and leader of these conversations. Thank you.
And as we wished Commissioner Carter a farewell in our last meeting, we have a new county commissioner joining us. That would be Commissioner Jacobs. Commissioner Jacobs, welcome to the HSAC. Look forward to having you being part of the team going forward. And for those who are not aware, Commissioner Jacobs has been heavily involved in the Familiar Faces Initiative, which intersects homelessness, hospitalizations, and frequent flyers of the jail, sort of folks who intersect with all three of those, and will be a great asset to have on the HSAC. So welcome, Commissioner Jacobs. Also have we have Nick Periante, who was in a city-appointed nonprofit seat, has resigned his seat due to conflicts. So there is a new posting out on the city website for a nonprofit to fill that seat. So if anybody knows anybody in the nonprofit, we are welcome to have that piece as well. So I think those are the big announcements at this point. Oh, Jay Mebane is joining. He's an HSAC member and is joining the Policy and Planning Committee. So that's a new announcement as well. And we'll be updating that list. And that may allow us, under the current governance structure, we'll have to look and see if that allows a new COC liaison to join Policy and Planning. So thank you, Jay, for joining the Policy and Planning Committee. Looking forward to seeing you at that committee meeting in January.
Great, looking forward to it.
Yep. And we've got a public comment. I might be going out of order with things, but we do have a public comment from Chris Noblet. Chris, are you on?
I am. Is now a good time?
What's that?
Is now a good time?
Yep.
Great, thanks. So hi, everybody. I'm Chris Noblet. I'm here on behalf of the North Carolina Union of the Homeless, and I'm also a member of the North Carolina Poor People's Campaign. I'm here today because we were deeply disappointed by the recent decision by the Durham Homeless Systems Advisory Committee, or at least elements of it, to advise the city manager to order the immediate halt of distribution of tents by HART. Yeah, and I'm here to, implore that the HSAC move to contact the city manager and reverse this ban on distributing tents to people who are unsheltered. And we asked this because we don't want Durham to set a dangerous precedent for the rest of the country in these uncertain times by denying life-saving temporary shelter during the coldest, darkest time of the year while, these tents grow dusty in a supply closet somewhere. Especially as rents and home payments remain at unrealistic levels and health insurance is locking people into insurmountable debt. We even had crazy hurricanes like Helene coming through and making countless North Carolinians homeless. I'm not homeless myself, but I am deeply affected by it and am always aware that I am, like most people, are just one paycheck or healthcare crisis away from homelessness. My sister-in-law is currently homeless. Her 3 kids, and she lived with my family for 6 months. And I did live outside for 6 months when I hiked the Appalachian Trail. And if you haven't lived outside for very long, it gets quite cold, even when you have the proper equipment. A tent actually saved my life from hypothermia when I was caught in a storm on an exposed mountain peak. So, I just want to briefly lay out, thank you for the time today, based on some conversations I have, why we think that HSAC should make the motion to request the city manager to reverse this ban on distributing tents. Some reasons I've heard for this ban was that the HERT team didn't have a policy for giving them out, which is true. But they have provided a comprehensive policy 24 hours after the ban that could serve as an interim policy while the policy and planning subcommittee can focus on other pressing priorities. I've also heard that there's concern that people wouldn't seek out services from the community of care funded NGOs. But as I've heard from people on this body, there are currently insufficient services and capacity for the current rate that folks are becoming homeless. So these temporary shelters could actually help provide some amount of stability for people to remain in town while they're waiting for their time to come up on these months-long waiting lists. I've also heard that it would create more visible encampments, which would overburden the already overstretched outreach teams, which is a real concern. I really hope that the recent proposal to the city and county can increase the outreach team capacity. And it sounds to me like maybe the outreach team policy needs to be updated to reflect the current conditions that they're working under. And there's always a possibility that there's still going to be folks sleeping under the awnings of businesses and other public places, and that's also going to produce calls from concerned citizens. And my last reasons here, there's concerns that there was another city that stopped a similar service of giving out tents, Portland, which kind of gave us the bandwidth to potentially set a good precedent in policy here in Durham for the rest of the nation. Portland actually resumed the tent distribution months ago because they didn't want to leave people out in the cold when they had these resources available. So we're very concerned that now Durham is setting a precedent, saying that it is okay to withhold these life-saving resources during the hardest time of the year to be homeless. And related, there's a concern that this policy will attract homeless people from out of town, increasing the already, the homeless population that's already with services that are being strained. And this makes us a little bit sad, just because if we follow this logic, in light of recent events with the Grants Pass ruling, cities and states across the country are passing bans on public camping, which essentially makes it illegal to be homeless. Actually, Greensboro just passed a public camping ban just a few weeks ago. Wilmington passed one earlier this year. Raleigh passed some limited bans in 2022. Charlotte has laws on the books, and so do some small cities in North Carolina. So if we extend this logic that we don't want to necessarily attract homeless people from out of town, I'm scared that the members on this committee might be supportive of criminalizing being homeless, which we think is unproductive for ending homelessness, which is the mission of this body.
Thank you,
so,
Mr. Mayor.
Yeah, I appreciate it. Thanks for your time, and just want to recognize this time of the year we're in now. So we're meeting on the third Wednesday instead of the fourth because that's going to be Christmas. We have a saying in the union that you can't worship a homeless immigrant, from out of town on Sunday, and then step over him on Monday. So, just to close, I urge the members of this body move to rescind the request to the city manager to halt the tent distributions and to accept the proposed distribution policy until a more comprehensive policy can be crafted, and resume tent distributions immediately so we can end the real amount of sickness and death that tents can prevent. Thank you.
Thank you, Mr. Noblet. I believe our chair is here. There you are, Madam Chair. I will turn the meeting back over to our chair. We went through announcements and public comment.
Good afternoon, everyone. I apologize for being late. And I believe our public comment section is ended. So now we're going to go to the approval of minutes. Members should have, sorry.
Hi, I had a public comment. I think I submitted it. I'm not sure if it went through.
Okay, I do apologize. Go ahead, Ms. Doherty.
3 minutes. Sorry, I forgot to mention that on the first one. I apologize for that.
Hi, everyone. I want to start by thanking the team and Colin for providing the budget for this coming year. Thank you for your diligence, hard work in addressing this crisis. Thank you for your efforts. They're appreciated. The other day, I walked outside to throw my trash out. A few moments outside, the cold struck me so bad that my back was aching. To the extent I couldn't even move. I was in so much pain. All this happened while I had a heavy sweater on. And it dawned on me that many don't have the privilege of having a moment in the cold, but forced to spend hours, days, and possibly weeks in the cold weather. Just those moments I spent outside in the cold, those short moments did that to me. I cannot imagine what it's doing to those that spend hours and days outside in the cold with nowhere to go and no one to turn to. By the grace of God, I sought refuge from the cold and the comfort of my home.
Yes.
The privilege many of us on here are blessed to do every night to escape the cold. Although I believe the budget is necessary, it is an understatement to the great need of our citizens. Just as one must go to the bathroom to relieve themselves of their humanly bodily fluids, a necessary act of all human beings. So such is shelter, to rest and lay one's head in a safe environment to function as every human being. If you all imagine yourself living on the streets, your children, your grandchildren, would you be as stable as you are on this meeting today? If you had nowhere to get a decent rest or had to worry about how you were going to spend your God-remaining days on a street or a city bed, as though you were going to a top model competition. Let the best man win. Housing should not be a pre-adventure. It is a necessary need of every human being, such as using the restroom. Shelter is a need of all human beings. It is required for one's livelihood and quality of life. For one to be in the cold and have housing as a maybe option is unconscionable, just as it would be having a toilet for one to relieve themselves as a maybe. An act that is out of every human being control, but necessary for one's life. Having a bathroom as a possibly would shock the conscience, given the necessity for it. So show human beings having a safe and secure shelter to lay their heads. Even considering housing for our citizens as a maybe
Dorothy,
is shocking. Okay, I'm gonna finish up now.
thank you.
You're welcome. It's shocking, given the nature and fact that it is a basic need of every human being. President Roosevelt said, it is the government responsibility.
Ms.
Okay.
Dorothy,
Yeah. Sure, you can wrap it up.
Apologize, but that's your time. Yes, ma'am, but you can
Thank you.
always sign up again for next time to finish your statements. Thank you so much for sharing. We really appreciate your comments. This time we're going to turn it over to approval of minutes. Members should have received their minutes for October 23rd and November 13th. Are there any edits or concerns? I'm gonna take your silence as no edits or concerns. If there are no edits or concerns, the floor is now open for a motion to approve the minutes for October 23rd and November 13th. Do we have a motion?
I move to approve, Madam Chair, Helen Tripp.
Thank you, Ms. Helen. Do we have a second?
Angela Holmes, I have second.
Thank you. All in favor indicate yes in the chat, against indicate no or abstain.
Madam Chair, are we approving them both together? Or separate?
Yes,
Okay.
if we can, yes. And then at this moment, we'll turn it over to Ms. Sharita for Policy and Planning Quarterly Report.
Before I get started, I just want to thank Mr. Norbert and Miss Dorothy for their public comment section, their public comments that they wanted to share with us today. I asked if it was okay if the HSAC could get their public comments in writing. Because I do think it's a responsibility of us as the HSAC to respond when folks are asking us stuff in public comment, and we don't always have the time to do so. So if they could be so kind as to submit those to us in writing, I would really appreciate it, because some of that stuff lives in policy and planning, and I would like to be responsive. Okay, so I will go on to the policy and planning update. So first and foremost, over the last quarter, this last quarter of the year, we have been watching our unsheltered numbers like hawks, getting updates from our coordinated entry department on a weekly basis. Our Monday's numbers show 44 families unsheltered, 20 families at risk of homelessness, 95 seniors unsheltered, and 19 singles at risk of homeless. And these are people that we are not equipped to help in our current system. So I just want to bring that as the public comment folks brought their grievances to the board. I just want you guys to be aware that our numbers are astronomical, and I do agree that we need to do something about it. I think I asked the question about if there was some funding and some option opportunities in the meantime, because what we put forth, which I'm going to get to as the last kind of update as we lead into the next item on our agenda. We do have a presentation for vote for HSAC on the next item on the agenda. We've also been talking with our lead group, our lived experience group, and that group has been working on the tent policy that we've been asked as a system to come up with, which also relates to Mr. Norbert's concerns about HART no longer being able to pass out tents to folks in our community. As of the last update, I think that the lead group was still working on that policy, if I'm not mistaken. If any staff has an update on that, we would really love to have it. The next thing we did in the last quarter is we created an ad hoc committee. The policy and planning, as well as our performance management, has the ability to set up special short-term committees to work on issues when we feel like there's something that needs to be fleshed out further. And we created an unsheltered ad hoc committee whose main charge was to talk about our unsheltered needs in the community and our ability to help or not help those folks, and how we could be better. They are still meeting, and I did talk to Drew Wooten, who is leading the ad hoc committee, and there are some plans for them to merge with the new city-county pre-sheltered task force and join their efforts together, because it was just too many meetings, as we all know. So we look forward to getting updates from that committee around that, our unsheltered response, and being able to bring that information back to the HSAC. The next broad topic we've discussed is our point in time count. It's coming up on January the 27th. our official email came out from our unsheltered coordinating agency, which is Housing for New Hope, today for you to mark your calendars, as well as with details on if you want to volunteer and those items. So please, if you got that today, please go back in, review that. And if you are so inclined to participate in our point in time count or lend your services in what other ways they may need assistance, please do so. We've been busy. Also in our last quarter, we've had some, we've been asking for quite a while on some updates on the affordable housing units that were a part of the affordable housing bond. And so we did some intentional work with community development and trying to get some feedback on the status of those units, lost opportunities, upcoming opportunities, and how we can best access and utilize those resources as they come online. I'm pleased to announce that community development has made some changes within community development to make sure there is a liaison person who is keeping their finger on the pulse and watching the changes with the properties as they come online and making sure that we don't miss opportunities. And then lastly, the last big item, we initially started talking about priorities for our homeless system. That has kind of transitioned into what we will be presenting following my my update as it relates to an ask that we'll be asking for HSAC approval for the fiscal year 2025-26. And you, Colin, are you ready to present that now? Because that would conclude my update, is that final conversation around the community, the HSAC asked to the city and county leadership in response to what we feel like our system needs. And that is it.
Colin, before
Yes.
you answer, I'm sorry, Sharita, can you?
I got it. The policy.
Well, wait, I see Commissioner Jacobs' hand up.
Okay.
I don't know if she had a comment for me before we transition.
Yeah, I just have a question. Thank you so much, Rita. The issue that you brought up around what units that the city have that especially may be applicable to people who are at 30% AMI or below, and being able to track and know about the opportunities for these units. What will be the actual mechanism around how the HSAC or all the partners who are actually working, most importantly, the partners who are actually serving people on the ground who are unhoused, what's going to be the actual process and mechanism around making sure that people know about the units, but also that there's an actual application process or a way to feed people who are already been identified needing that housing, or let's say supportive or transitional housing? I mean, how is it actually going to work?
And so I think so the reason why I came up with policy and planning is because people who were like me, who work directly with people and are trying to get them access to things I know that we've voted on or made room for, we started asking questions because we did have some lost opportunities. And so there were some things that community development told us as it relates to the multifamily department and our homeless services department within. They were not doing a lot of good communication together, hoping to fix that, but also what they've told us is that there were, like, once the contracts get handed out, like the names of the properties would continue to change. So things would get lost just because changes would happen. And so what community development has committed to us is to have this person sit in a role that kind of liaisons across to make sure we know when things are coming online. And then as far as how we will access it, I think that's a wait and see for us. My hope is that it would be connected to our by-lane list prioritization. And so, folks would definitely have to be somewhere on the by name list getting services. What that also poses is for all the people we can't serve, they don't have a service provider to get them connected for them to access the resource either. And so that's why it becomes an even bigger problem, because we have so many people that we're not even serving. We can't touch it because we don't have the capacity to do so. So that's kind of the answer. I don't know if Colin has anything to add.
I can help fill in a couple gaps that have become clear on this. So first, we have to understand how community development department does multifamily development. And the city has historically, through community development, funded the construction side of the project. Once that construction is done, the lease up is handed off to a property management group. And then a year later, 2 years later, depending on what the monitoring schedule is, community development goes back and says, hey, did you follow your tenant selection plan? Did you lease? And do you have people with the right income brackets in the right units at the right times? And that's how things have historically worked. This is the first time where it's, oh, wait, there's a step that we have never historically done as a department, where we're saying, oh, we need to be in the middle of the lease up process. Historically, community development has not done that. I will share that we have done that very successfully with 10 units at Casas Bryan Place and got 10 units leased up through our by name list, through our coordinated entry process, where the coordinated entry administrator on the CDD team gets all the paperwork that property manager would like to have filled out, the application and any backup documents, prioritizes people who have subsidies and supportive services if needed. And there are some people who don't necessarily need a subsidy or supportive services. So it's going through and determining who's the best fit for that property, then coordinates the referral process to say, hey, here's this tenant, here's this group. We are in the process of looking at the narrative of RFPs and figuring out how did people, because not everybody who applied for funding said they would accept COC referrals or work with the homeless in the continuum of care. There is a group of people who are doing tax credit properties, and by being a tax credit project, they have to take people from Target and Key, which include people who are experiencing homelessness and or disabilities, which come off of the North Carolina Department of Health and Human Services waiting list. And a lot of those have outside providers. Some of those people could be tied to our continuum of care, but we do not have direct input into who those folks are. So we are in the process right now of working with to determine how many units and which units and when and what the process will look like for Hardy Terrace and for Cedar Trace. Those are two that are in the pipeline. Hardy Street, sorry. Hardy Street, too many Hardys, but Hardy Street and Cedar Terrace, that we are working on the referral process for those 2 units that will be leasing up while we're reconciling the other pieces. And we're working with DHA on the commitments that are in their plans that have been there, the 5% of public housing and those pieces to tighten those up. So that's kind of the status update and the process of how that works. And
Okay, well, I appreciate hearing that. And, you know, the county also has a vested interest because we have invested a lot of our ARPA dollars, $13 million in many of these units as well. So I just want to encourage the folks here who are the expert on this, that we be very proactive, working with the city community development staff in putting forth what we recommend is number one, needed for now, how that process should work, and number two, what is needed to be incorporated into any future contracts that involve city and county dollars. So, but yeah, so I think it's really important that we stay on top of this issue, and I hope we'll get regular reports at our monthly meetings on how this is moving forward. Thank you.
We do need your help, Commissioner Jacobs, on the county process. On the county, I think it's 500 block of Main Street. There was a request from HSAC a couple of years ago for units in the 500 block, but we've never heard back from whether or not the developer or the county would allow or provide any units there. So perhaps you could help us crack that nut.
Okay, what about the 300 East
Or
Main
it's
Street?
300, it's either or. I don't remember.
Oh, okay, well, they're both, yeah, there's gonna be 100 units at 300 and around 200 units on 500, which obviously it's not even started being built yet, but I don't know the number of 300, AMI and below. So yes, happy if you can send me information, and Samantha I know is on here, and the two of us can help make that happen.
You got it. I'll find the letter that was
Okay.
sent a couple years ago.
Great,
asking
thank
for
you
it.
so much.
You got it.
Awesome.
I saw Eliza's hand.
I may change the topic, so I'm gonna let other people go because I saw these hands come up as we were having that conversation.
Okay, Dorothy?
I was gonna ask Colin about the housing vouchers. Is it called housing vouchers? Are they similar to housing vouchers? Or do they pay the total amount of what the rent costs? And if so, I don't know how feasible or reasonable that may be to continue to make constant payments, continuous payments for a resident without them having any skin in the game, meaning that they're not contributing to their portion, or they don't even have a portion that they're contributing to. I don't even know how reasonable that is not to have them contribute. So can you explain, is it a program based on your income, or
Sure.
do the agency contributes 100% towards their rent? And if so, how long are they doing this? And if they're trying to make it a permanent thing rather than try to encourage the clients to seek employment, as well as some type of form of income, whether it's disability or any kind of income that they have coming in.
Sure. When we're talking about, and most of the properties that are funded are part of a low-income housing tax credit deal. So we're providing gap financing in a lot of these projects. In a low-income housing tax credit deal, a certain number of units are set aside for 30% AMI and 60% AMI, area median income. The 30% AMI units and 60% units have a fixed cost. So even if I make 10% of the area median income, I still have to pay the 30% AMI cost. The only way that household at 10% AMI can pay a 30% unit cost is with a housing choice voucher or a permanent supportive housing placement or rapid rehousing assistance, with the hope that they will increase their income to afford a 30% AMI unit. 30% AMI units are not income driven, i.e. 30% of somebody making 10% of the AMI will not pay $50 for a 30% AMI unit. They're going to be required to pay the full, I don't know what a one bedroom is, but call it $500. They would be required to pay the full $500, even if they're at 10% and they don't even make $500 a month. That's where the vouchers come in. Then that's just a tax credit rule. Public housing is a different part. Public housing is, there are caps on percentage of income and a minimum amount that can be charged, to my understanding. We got Jason Brenner from Housing Authority. So Jason, please jump in and correct me if I'm misspeaking, but
you're correct, Colin.
Thank you. So public housing and housing choice vouchers from the Housing Authority have a minimum, and I believe it's $50 is the minimum that you have to pay. So you got to be able to pay $50. So that's your skin in the game. And then there's sort of a maximum of a maximum of 30% of their income, and it's an adjusted income. There's a whole worksheet that goes through and allows and disallows and to figure out what their portion of the rent would be. Right now, there are no additional housing choice vouchers being issued. Those housing choice vouchers at this point are needed due to relocation of public housing for redevelopment. Is that an accurate statement, Jason?
That's correct.
So
Yes,
as as DHA is redeveloping all of their public housing, people who are in public housing have to be relocated by federal statute. They cannot be turned out on the streets and be made homeless to tear down and rebuild their properties. So folks have to be moved, relocated, rents have to be subsidized in other locations. Then when the new development gets built, there is a first right of refusal for people who are relocated to be able to come back to those units before those units can go out to the market for other eligible populations. So I hope that answers your question.
Yeah, I just don't understand why they're tearing down affordable housing, given the great need of it, and relocating these people that's been here for years.
Because the public housing is beyond its life expectancy and is health or safety hazards, and it's cheaper to redevelop it than it is to keep putting repairs into it and bringing it up to code. A lot of the public housing is over 50 years old in Durham, and the units have not been able to be maintained to the level they need to due to consistent HUD cuts, if that's a polite way of saying it. HUD has slowly over the years eroded operations money in public housing to keep those units up to snuff.
Okay, my last question quickly. What is the situation with CAP? I know in Virginia and New York and other states, I've heard NYPD, New York City police officers, as well as nurses and other professionals, they removed CAP from a lot of states because they noticed that, God forbid, if someone's making a good amount of money, if they become unemployed, then they're back on the streets. So I know in states like Virginia and New York, and possibly I've heard South Carolina, remove CAP. And what my knowledge of it is that you can only make a certain amount. So it's kind of a negative effect because a lot of people are not making that certain amount. So they're basically decreasing their ability to grow and better themselves because they want to keep themselves at that certain amount. So New York and Virginia and other states removed CAP, where they said, listen, the rent is getting high. Let's just let them pay 30% of their income, no matter if they're NYPD or nurses. Do you guys have the same program? And if not, why don't you model after these other states that are very successful at doing so? Just like Social Security, that Italy was very successful with Social Security, and that's why FDR decided to do it in America, because we didn't have a Social Security program. So he went to the people that did it right. And that's why we have our Constitution, because we went to other people and see what they did. So why are we not modeling at their states that removed CAP because it was causing a problem with the citizens?
Some of this goes to state laws, and I'm happy to have a meeting with you, Dorothy, to work through these, but we need to move on with the agenda.
Yes.
Send
Again,
me an email. I'm happy to set up a meeting and we can talk through all this. I'm happy to do that.
Again, I do apologize, but we just have to move on with our agenda. Sharita, are you ready to share about the get back to my agenda, the city and county budget requests for homeless systems and funding?
Sure. Colin, do you have a slide?
Give me 1 minute and I will bring up the question that we emailed. Well, not the question. We emailed out
Right.
the recommendation from policy and planning. I assume all of the HSAC members received that.
So I just want you guys to know that we had a very robust conversation about this ask that came up. We did make a couple of modifications to that ask to include our not traditional shelter shelter options, so that there could be room for us to try to implement some things that we need that we don't have, with the understanding that as a community we needed to increase our bed supply, for lack of a better word, beyond what our normal pre-COVID numbers look like. And so that was in the amount of $1.2 million. And then we asked for an additional $1.2 million to expand diversion funds, because we've talked about, that the fact that we don't have much diversion money right now, and diversion, the little bit we do have, is only being used to relocate folks. Is that correct, Colin?
That's correct. At this point, it's to travel diversion, not first and last month rent assistance.
Right. To increase our street outreach capacity, and to create flexible housing subsidies and fund supportive services, which are things that would help us be able to meet funding needs of some of our folks that don't make enough income to afford housing without some kind of financial support from the community or a city or county resource, for lack of a better word. So that is the request we have. Colin's gonna put it here. This is an item requiring a vote for a formal letter to be developed from the HSAC body as a whole to go forward to the city and county for these ask amounts. And we do understand that this is not an adequate number for us to do do justice to the level of need we have. We do understand that, but we also understand that city and county contributions are vital to us getting other people, employers, corporations at the table to help us further fund the resources we need in our city around housing need, and ending homelessness in Durham. And Colin, you can take the rest.
Sure. So this is how the breakout is at this point, and it's $200,000 to add additional diversion funds to coordinate entry with diversion to help people exit homelessness. That could be a travel diversion or security deposit if needed to help people exit unsheltered homelessness or homelessness in general. $300,000 to increase street outreach capacity. Right now, there's only 5 staff people managing 173 encampment sites. 73 of those are active. And that same group is also responsible for going out and doing canvassing and providing supportive services to our neighbors who are unsheltered. Asking for $700,000 for flexible housing subsidies and supportive services. That money would go towards subsidizing rent and bringing in appropriate supportive services. So appropriate supportive services does not limit itself to just case management. It could fill gaps where somebody might qualify for Medicaid services, but Medicaid hasn't kicked in yet, and they may need some assistance for a minute, or Medicaid doesn't cover this. So this is a place where it could cover a little bit of gap in services if a household were to require it. If not, it would just go back to standard case management, connecting to resources in the community, or paying rent if there are no supportive services required for that household that need to be pulled out of the homeless system. If Medicaid or some other funding source, SAMHSA, the mental health substance abuse program had grants out there that somebody were to be awarded for supportive services for that, they could also use that funding and then use this for the rents if they had all the supportive services covered through a private funder or other government entity. And knowing city and county like to split things 50-50 a lot of times, a request to Durham County in the amount not to exceed $1 million. And that would increase emergency shelter capacity that would bring us back above our pre-pandemic shelter. So right now, our emergency shelter system is down 15 beds for women and 18 beds for men at Urban Ministries due to space and bed configurations. So this would ensure that we have to bring in at least 16 women, at least 19 men. And at this point, any additional families with children or couples would be an increase. So you'd need to increase all of those. It's important to note that this is a way to get creative in emergency shelter provision. It does not have to be a traditional, building with people in there. It could be pallet homes, sanctioned encampments, safe parking lots, or any other creative solution that would provide temporary shelter to persons experiencing unsheltered homelessness while they are working on looking for permanent housing and getting connected to ongoing, long-term self-sufficiency and services. Then a not to exceed $300,000 for day center and appropriate supportive services. This would be to providing shelter, shelter toilets and showers and mail service, supportive services to help people get IDs, a way for people who run shelter to get reconnected to Medicaid and SNAP and some of the other entitlement benefits to help with disability applications if possible. So this was sort of a not to exceed. We did not flush out how much would go to each of these, but wanted to make sure there's no more than $1.2 million going. And it would be no more than $1 million going to the emergency shelter and no more than 300,000 for a day center. So it could be $1 million at emergency shelter, and that would leave 200,000 for supportive services. And it could be 300,000 for day service or day center and 900,000 for emergency shelter. That would be worked out during an RFP process. And as Chair of Policy and Planning Committee said, as Sharita said, she's the chair of the Policy and Planning Committee. We know $2.4 million is a drop in the bucket in the need, but we have to make a reasonable request because once these dollars go into a system, it's very difficult to pull them out without seeing numbers jump up. So when you put in 2.4 million, that 2.4 million slowly grows every year as the cost of implementing these strategies goes up. So it's sort of where do we start and how do we gradually build up to meet some of the needs and hopefully bring in some of our private partners as well to help cover some of these expenses.
Do we have any questions? Colin, I think Sharita asked you a question in the chat. If funded per our request, there would be a RFP process for completion to receive these funds.
Madam Chair, I was just elaborating on what Colin was presenting, just to kind of give people background, not a question.
Thank you. Looks like Ms. Jacobs and then
Yes, well, first of all, I just want to thank the policy committee for taking the lead on this. And I did, as I said in our joint city county meeting, it is good to start getting something in the pipeline for the city county budget process because departments are already starting to work on budgets. So I think that is a great idea to be proactive. I do suggest, though, that there really does need to be more detail in the budget in terms of, what the breakdown of what these expenses would be related to directly. And I see there is some linking to outcomes, but I do think in general, when requests are put in for budget items, the budget staff do usually want to see more detail. So I do suggest that. And then also I'm hoping that somebody, maybe Eliza, I'm putting you on the spot here, will report out on the work of the pre-shelter committee, because there is some overlap here. And if we are able to get some of the immediate needs that have come out of the pre-shelter committee met, then some of what's requested here will actually be redundant. So I think there should be some acknowledging that we're hoping to get some of these things funded actually more quickly than July 1st, because as we know, we are in crisis now, and some of these things really can't wait until July 1st. So thank you.
I'm happy to jump in and share what I was hoping to share earlier. Sharita gave the update that the subcommittee for policy and planning, I am blanking on the name, but the one that Drew is supporting.
The ad hoc unsheltered committee.
Thank you. Thank you. She shared that Drew had plans to connect with the pre-housing shelter group, and that has happened. And there have been ongoing meetings and a big push here, as we heard from county commissioners and city council members about the need for requests that are before the next budget year. So that is ongoing. Ebony Ross is a part of that pre-housing shelter group, who's our HSAC chair. And I think, Drew, you might have to help me, but I think most or all members from that ad hoc subcommittee are at the table. Are we missing anybody, Drew, that was a part of that subcommittee on HSAC?
Not that I'm aware of. No, I think everyone's here.
Right. So I think what we're working on is kind of a crisis response and getting that not only to HSAC as an update, but also to our electeds as they were looking for that type of infusion of support. There is this balance of thinking about crisis response would help us get to the next budget year. And there is a need to increase funding, annual funding to these buckets as we're seeing a need to infuse crisis dollars. So I think there's like a timeline thing we're thinking about. I would also say something that has come up in our group is the RFP process is not going to line up with the budget process in some cases, to my understanding. So trying to understand exactly what you're saying, Wendy, Commissioner Jacobs, in that there is overlap, but also what we really want to do is have recommendations build on each other. And so part of that is that the work is still happening to really bring forward these more detailed proposals in crisis response. And there are clear alignments to some of these items here. And then also thinking about some of the longer term recommendations. As a task force, as a housing task force, we've been tasked with short, medium, and long-term recommendations. And we've added this new category of crisis. But the way that I see it is that this should all be connected, and that a crisis response should be a one-time thing. And how do we set ourselves up for success moving forward? And that needs to be a part of what we're thinking about now, but also infusing into budget for following years. So that's the update I have. I think I'm curious about maybe a little bit more information around the difference between an HSAC request, or maybe they're the same thing, a community development request, and how does timing work? Like, is it possible for HSAC to say more details are coming? Like, how important is this to go in now? How is that helpful and important at this moment?
And Colin, before you, if I may, before you answer Eliza's question, because mine may actually build on to hers. And I definitely agree with Commissioner Jacobs with more detail, and I agree with you, Eliza. What I would like to see done is to, and I stated it in the planning and policy meeting, is to not have us continue to put Band-Aids on large wounds. And if we can do a detailed budget and request additional funds, even more than the 1.2 from the city and 1.2 from the county, even if it extends a little bit past wanting to present in January, then I would recommend that. Because if not, we're going to continue to play small and be behind the ball, because we need more. And if we know we need more, then let's ask for more and then let the commissioners and council members say, this is what we can do.
Go ahead, Russ, and I'll respond to sort of all those questions.
No, I just want to affirm, and I appreciate what both Eliza and Abin have said, because I think part of our opportunity here is to start weaving these pieces together. I mean, going back to the earlier conversation about these set-asides within some of these new projects, and I think I've said versions of this before, but you know, if we know some of those units, like 3-bedroom units at Hardy Street, maybe $675 a month. If we can have flexible subsidies, we're creating a path to housing for more people. We are also creating paths for people that are in rapid rehousing programs that need to go on to something else, and creating some actual flow in the system. So I agree that it's let's you know, I'm going to say it, like, let's keep also working toward a plan so we can actually weave these things together and over time really be funding them. And I mean a community public-private partnership plan beyond just what we know HUD needs, so that we can continue to build from where we are now, which is much improved even over the last 30 days towards weaving these resources together in meaningful ways that make a difference.
Yes. And yes, we recognize there's a lot more need in the community. Policy and planning ranked a bunch of things in terms of highest priority to not lowest priority, but what were priority 1 items, because every time the community development homeless team was turning around, there was a new, like, we need to fund this, we need to fund this. And it's really hard to get anything moving when everything's a priority. So when everything's a priority, nothing's a priority. So we made a list of all of the things that everybody said needed to be funded, and ask policy and planning, please prioritize these. And the request that we put forward addresses all of the tier 1 priority items. It may not be $10 million that's needed, but also looking at, and I'm going to have to, Bo, I may defer to you a little bit since you know more about the city budget process. These are asking for ongoing requests. And when there might only be a total of $20 million available across the city, tapping into that, and there's $50 to $100 million of request for that 20 million, we have to put something in that is going to help move the needle. It may not solve the problem, but we have to put something in that could be possibly taken up in the budget and not be thrown away. We've put forth $100 million requests in previous years, and it went nowhere. We've put forth $5 million request and went nowhere. So this was kind of saying, okay, we're learning, and we're learning what we need to do to be able to move this forward. And as a team, we sort of said, here's what we can do. One, we also have to recognize that the community development staff is the one who has to take all of this money, get it into contracts. We also have to have providers in the community who have infrastructure in place to absorb the money. And this is a 1-year allocation that would be potentially renewable depending on how city and county did this. And we've got to make sure we've got infrastructure in place to absorb it. So if we brought in, and experience has told us, even with $2 million coming into our system, like we had with ESG COVID, it's very difficult to ramp up $2 million, which is a lot of money in the homeless system, just due to the need to hire additional staff, bring them on, get contracts executed, get it moving. It takes time to be able to do this. So we had to put forth something that would be a reasonable amount of what could we do in a relatively short period of time and be able to make an immediate difference, rather than let's put forth a $10 million request. We know there's hundreds of millions of dollars or tens of millions of dollars needed in the homeless system. And to be able to get to that point, the number 1 priority was we need a strategic plan, but we can't wait for a strategic plan to be able to do something. And that's why we chose the top priorities that came out of policy and planning and put forth okay, what can we do in 1 year that will help some number while we are working on the strategic plan, that we could come back with a more solid long-term investment of saying city, county, Duke, Alliance, who else needs to be at this table to do this? Because to really solve homelessness, it's a public-private partnership all day long. It's not something governments can do on their own. And Bo, do you want to chime in on anything or help clarify or help?
I actually think you really did a great job, Colin, describing the process, and I think I don't want to weigh in any more than that. Colin, you and your team who support HSAC have kind of been through the funding process, and frankly, you bring more knowledge to how HSAC has interacted with the budget process than I do right now. So I think I'll defer to what I thought was a very detailed answer. Thank you.
Thank you. The other piece is we can try and put more detail into the budget request. The problem is we need to get this request into the elected officials in January. The last few years that we've put in and taken our time and dragged our feet, we've gotten it in too far into the budget cycle and the money's gone. So this is something that, while it may not have all the details, if we don't get something into elected officials, it's not on the radar. They can always come back and say, can you fill in, what does this mean exactly? And we know that $1 million in emergency shelter will serve at least 19 men, 16 women, and at least one additional family and at least one additional couple, let's say. How that cost gets broken out would be, it could be cost for shelter and supportive services and or food, or here are the eligible expenses. But we're not going to get into, you have to spend this much on these particular items. That would be part of the budget proposal in an RFP. But we can sort of say, here are the eligible expenses, which would be a very easy thing for us to put into place on what would be eligible expenses and roughly how many people would benefit from these types of services. We could definitely do that. Does that help? Does that answer questions? And I see a lot of people.
Yeah.
Thanks, Colin. So just wanted to circle back to the question I had, or to make sure I'm clear. The HSAC request, it would be important to have an HSAC request of some form in January. Could it be followed up with more detail? Like, so that it sounds like it's important to have a request on the record in folks' minds on the HSAC side, because I'm also understanding there's a different hat here that is community development submits a budget request that's separate from HSAC request. So that's the other piece that I think would be helpful to clarify on the timeline.
Sure.
And then secondarily could a response be approving something today that's more general and making sure in what gets shared forward that there is a follow-up with more detail so that it's on folks' radars? Would that fit into a timeline? And that also gives us time to align thinking across groups and make sure we're understanding a timeline here.
Yes, maybe. So let me start with, so the city has its own departmental budget process. So we, as the community development team, when we saw a budget item come up, we did put forth knowing like, hey, we're not sure where HSAC will be on all of this, but we as a homeless team did put forth through the departmental budget piece a request that mirrors the request to the city from HSAC. Because we looked at what was policy and planning indicating as high priority items and trying to make sure that we could dovetail if there was something coming out of the homeless system and coming out of the homeless team, let's make sure these are kind of the same. In the past, there have been sometimes a request for staff positions coming out of the homeless team, and HSAC is asking for housing, and you kind of need both. So there was a request from the department that went through the departmental process. This is a request from the Homeless Services Advisory Committee to the elected officials. The city has a participatory budget process. The county does not have that so much, but this is a way of letting, as Commissioner Carter shared last time, letting the commissioners and letting council members know this is something that people care about and want to see money spent on. And being able to sort of put it on the radar and keep it on the forefront to be possible, to be, I don't want to say it's going to be funded, but there's a better chance of things being funded when there's voices coming to the table per Commissioner Carter saying that, you know, when commissioners hear from constituents, we want this, it's, you know, more likely to get a little traction versus it's one person saying it and that's it and it falls off the cliff. And Commissioner Jacobs, you might be able to chime in, and I don't know if Councilmember Cook is here today or not, but they would be the elected officials who would be able to help explain how they handle requests that come from these types of bodies on the go forward. So that's how those two department and HSAC budgets sort of come through in different channels, and eventually they have to be approved by elected boards with input from budget and city staffs and county staff. So I don't know if Councilmember Cook or Commissioner Jacobs want to chime in on how elected officials handle these types of things, or have any insight.
Yeah, I'm happy. I think Chelsea is here in the meeting. She can chime in too, but yeah, I think this has come through the Joint City County Planning Committee. So it's already been brought to the attention of staff and elected officials. And so yeah, I agree that getting something in process in the pipeline is good. But I do agree with Eliza's suggestion that something can still be brought back again to this group to flesh things out a little bit more. And that also can still be, especially on the county side, you know, things might be kind of preliminary, like this is very preliminary, and things can be, you know, as you know, you get into January and February, having more detail, because I assume our budget staff will ask for more detail. So it's something that's probably going to be requested, and that could be then shared back with the larger group. Yeah.
Yeah, I would agree with that. I think another piece of this that Colin's alluding to is that the council is also able to set priorities, and that is done through a process. We have 2 meetings in February and again in March, during which if we have brought, each council member has the ability to bring forth ideas or budgetary items that we'd like to prioritize. And if those get the support of the rest of the council, then the manager takes those into account, as opposed to them just coming from a department. They will know to be prioritized by the electeds. So our budgetary requests are due mid-January. That is the 17th of January, I believe, is our due date. So if any of the council wants to bring in, and I am the liaison to HSAC, and I'm happy to bring forth some or all of these items as priorities, depending on how they move through this process. If we were going to do that, then I would need to have those pretty solidified by the 17th. And I would agree with Commissioner Jacobs in that our staff, I'm sure, is going to ask for more details, but my colleagues might ask for more details. And so it's going to be really difficult to bring a priority item that is not well fleshed out, because those questions are going to come up. And if we want to set that as a priority, I'm going to need to be able to explain exactly where that money will go. So I hope that answers that question.
And Colin, I might just add, I think Councilmember Cook described our process very well. You know, I think, Colin, you know this, but just for the benefit of the committee, I think some of that extra detail, how were the numbers arrived at? You know, how did the numbers relate to staffing resources? Why was that number of staff recommended versus some other level of assistance when it comes to the diversion assistance? You know, obviously, I know there's a lot of sentiment on the HSAC that this is just a drop in the bucket, but even so, what you are buying and why those were you described the Policy and Planning Committee said these are tier 1 communities. I think Councilmember Cook and her colleagues, as well as Commissioner Jacobs and her colleagues, their staff will help at least identify, exactly what those asks are going to and what the collective wisdom of this committee believes, would be the impact of those dollars. So just to help all the folks on the call understand kind of how the elected bodies will receive that, I think that's that's the kind of context of what more detail will do. And I agree that detail doesn't necessarily all have to be in the initial request, but I would also say the sooner the better. Our staff are gearing up right now for that process. So.
Thank you, Bo. And I think that's a really important piece to note. We're asking the HSAC to approve the high-level dollar amounts. We, as sort of the staff to HSAC, can fill in the details on how the numbers were arrived at, since the proposal kind of came through us with policy and planning. We can fill in those gaps and come back to the county if if the HSAC agrees that these dollar amounts are the appropriate dollar amounts for what you want to put forward. We do need to get moving on that, because as Councilmember Cook said, she needs this no sooner or no later than January 17th. We don't have another HSAC meeting before then. So we can miss the window and punt it another year if you'd like to. That's perfectly okay. I don't think I'm not hearing that's something folks want to do. So we can, I think you've got a choice, Madam Chair, of moving forward with a vote to move forward with this, or to pull it back and, think it through and work on something different. But that's the committee's decision to choose which way to go, knowing that in the past, when we've brought things in February and March, it's too late.
Pardon me, isn't the next HSAC meeting on January the 15th? And planning and policy is on the 13th.
I had it on the I thought I had it on the 22nd.
It's the 15th.
Yes, it is the 15th. Sorry, I thought it was the 22nd that we had it. But even if we made a decision on the 15th, there still needs to be time to get all that detail written up to the chair to sign and get it sent out to everybody, which is a really tight turnaround. It's all up to you all.
Okay, so I will open the floor to make a motion.
I did see Russ's hand go up for a minute, and I saw Jay's hand up at one point, so I don't know. Jay,
just a clarifying question before one of us gives a motion. Are we able to empower the executive committee to act in the stead of the whole HSAC, if necessary, to push forward what would come from policy and planning? I mean, it's a little easier to get that group together than open it up for, most nonprofit boards kind of function this way as needed. It's a lot easier to get executive committee together early if necessary, and then just throw out the invite for anybody else to join who could come. But I didn't know if that would be a possibility for keeping it moving forward at a good clip.
Yes, you could do that. Or not you, but the HSAC could make a motion to let the executive committee flush out any needed details as required by city or county required to handle this. And I see Sharita's hand went up, and I see Councilmember Cook's hand went up. So, Chair, where would you like to start? You want to start with Sharita?
Okay, go ahead, Sharita.
So my question is, if the body is feeling like we don't move forward on a motion right now today, and it needed to be fleshed out more, what is the expectation of the body as it pertains to that? Because I know that in our policy and planning meeting, we did this same thing happen, where we were talking about the amounts and was this enough, and should we ask for more, and things like we did a lot of that going back and forth to come to what we presented to you guys today, even suggesting having another meeting, emergency meeting for policy and planning to further flesh out. So I'm just trying to make sure that if we opt to delay this, what is the expectation of the body that we do in that time? Is that to bring back a higher budget request? What is that? What is that ask? What is the hesitation? Madam Chair, I think, I see Dorothy's hand, but I think Chelsea had put something in the comments, like right when I started talking.
Sure, go ahead, Councilman.
Thank you. So I guess my question is, every time that I've received this proposal, I've only gotten this 1-page document. And assumptively, we got to those numbers with some actual data. Even that would be helpful. And I guess I'm just a little bit concerned that that hasn't come out yet, and why we haven't gotten just even that amount of detail. I think
Because
would be
I think that
great.
was gonna come out in the formal letter. So this is the recommendation from policy and planning. It's not the letter. The body actually has to vote, you know, for us to either carry this forward, and then our community development staff will then like formulate the official ask with all of the numbers and all of those things. But we did, like, literally in our meeting ask for the numbers. How did you get to these numbers that you got to? How many people, like, we fleshed that out in policy and planning, which is again my pitch for why I feel like people need to join a subcommittee, because a lot of work happens in the subcommittee. When we get the HSAC, it's supposed to be us ready to be moving forward because we flushed it out in our subcommittee meetings. I just want to remind people of that. Please, please, please pick a committee and come and join and lend your voices so that when we come to this meeting, we can do the work that we need to do.
Yeah, I appreciate that. And you'll have to forgive me because I would have loved to have been there, but I was in court, unfortunately. But I do think that at least would be helpful to hear in just presentation of this. And don't need it to rehash what y'all did in policy and planning, but kind of just a little bit more information would be helpful.
If we needed to, is voting via email an option?
Hold on, Eliza and Dorothy have hands up too. But yes, you could do an email vote. Keep in mind, most of us are going to be out like starting Friday this week until after the first of the year. So you're really compressing a whole lot of work into about 3 days. When we come back, because the executive committee meets January 3rd. And then 2 weeks after that, you got to have all this stuff done. So we're here to serve however we can. And just letting you know kind of where we are at this point in terms of timelines and availabilities.
Okay. Dorothy?
Helen, I was gonna say, I don't know how long you've been doing this, but I'm assuming it's been almost a decade. And I'm sure you're familiar with budgets that have been going on for the time period that you have been here, and you know the need and you know the procedure. So I just have the question is, this might not necessarily get approved. They might ask questions leading to more information. We're just trying to present something to them. And if they have questions, you will present that to the mayor. I'm not sure who's going to, but if they have questions about the budget, you guys will be able to follow up with questions.
Yes.
As I'm assuming they would, a courtroom. So it's not concluded by approving this budget. It's just presenting something to the committee to say, okay, here's the need based on my experience, based on over the years, the numbers, here's what we have as far as statistics and the numbers. We would like to have this looked at and approved. If they have questions, these people are very intelligent. They have, you know, they're well equipped to know what they need, and they've been approving budgets, I'm assuming, for many years now. So it's just basically you having something to present, right? Not that a decision will be made at that moment. You're just trying to present something, correct?
Yes, we will fill in some detail on how we got to these numbers as Sharita shared. We went through all of this in policy and planning. There's some detail in this The challenge that we've had is we've given lots of detail in the past and we've given cliff notes in the past, and it's hard to give everybody information in ways they want to receive it to such a large and diverse group. So we tried to sort of say, here's what we need at a high level. And can we agree that these are needed activities with these dollar amounts, with these numbers of people to be served? And then we can make the formal request to those elected bodies, using this as the blueprint and then filling in details, but not deviating from that high level. There might need to be, you know, a lot more data put in or requested as you go through that budget process, and we can work through that. But at this point, it was sort of, does the HSAC want to make a request? And this is the path forward.
Okay, Eliza, I think we saw your message in the chat, but is there something else you wanted to add?
Nope, just that I'm interested in making a motion on what we have today. I'm also interested in making a motion on deputizing you, Chair Ross, to sign on with the details that will come from pre-housing shelter group, which is tied to policy and planning. And I think that we can identify the overlap and do some of that, but be moving both things at the same time, and move forward what policy and planning has done. Thank you so much, Sharita, for explaining that process again. But I see that as a path forward that I think there could be some alignment on. And I'm happy to make a motion, but we'll let other folks speak. And when we're ready for a motion, I'm happy to do that.
Okay, Reverend Vaughn?
Yes, I agree with Eliza. I had noted Commissioner Jacobs' note in the chat that we acknowledge what was happening with the pre-shelter task force and integrate the budgets. So I'm in agreement with Eliza's point of moving both ahead, and I would be willing to second that motion.
Okay, do we have any other questions before we open the floor for the motion?
Okay,
I
so
would like to, go
you
ahead.
want me to give the motion?
Sure, go
I think
ahead.
there's two. So I'll start with the first is what we have in front of us. So I make a motion to approve the recommendation we have in front of us to move forward to letter form with the additional details that y'all have described today to be signed by Chair Ross and sent to our elected officials.
And I second that motion.
All in favor, please vote in the chat. Feel free to abstain if you need to. Okay, looks like that motion carries. Okay,
Did I go with the second one?
sure.
Okay. I make a motion to deputize Chair Ross to sign HSAC on in support of the crisis recommendations that come forward as a part of the pre-housing shelter subcommittee of the Housing Task Force. With an asterisk recognizing that there will be potential overlap on some of the items, and we'll work that out and make sure that's clear with that request that comes forward to elected officials.
And again, I second that motion.
Please vote in the chat. Yes, if you agree, and abstain if you need to. It also looks like that motion carries. It is now 4:29, and I understand we're trying to be respectful of everybody's time, but we still have a couple of items on the agenda. Anthony, are you available to give the update regarding the performance metrics?
Madam Chair, in an
Yes.
interest of time, I believe Anthony might be able to send his information via email.
Okay,
It's been presented in like 4 committees so far. This was just sort of an update. I would say the
Okay.
more pressing and time-sensitive matter would just be just a very brief white flag and point in time, because those are coming up, and Night of Remembrance, which we've shared a few times before, but we can send that out via an email. But white flag has a few changes for the holiday season that I think it's important for the full COC that's here and HSAC to be aware of. And Drew's here, and a quick update on pit count in January.
Okay. We'll turn it over to you, Drew.
Hey, good afternoon, everyone. My name is Drew. I serve as the director of Open Table Ministry. We are providing white flag services for this cold weather season. So just a very brief update about how that will be working. North Carolina winters are notorious. It's been very mild and it's been very cold already, all before Christmas. So the way our white flags nights are generally going to work this year is that we'll be hosting a overflow congregate shelter at Yates Baptist Church. This is a new site for us. It's on Chapel Hill Road. There are 2 bus lines. All this information can be found on our website. The way we're communicating this is on Mondays. There is a unsheltered by names list call that takes place every Monday morning. A lot of folks working with the Unsheltered Community, Housing for New Hope as the Unsheltered Coordinating Agency, the Heart Team, and then Open Table Ministry. We also want to make sure that we're communicating with other first responders, community paramedics, anyone who might need to access emergency shelter on really cold nights. But we're opening overflow beds. We're providing 20 spaces on nights where the weather is forecasted to go below 32 degrees or below 35 degrees with precipitation. We're not the only provider that's providing white flag nights. Urban Ministries of Durham is also providing 12 overflow spaces for men and 4 for women. And then Families Moving Forward also has 4 family rooms that are available for families who are experiencing unsheltered homelessness on those really cold nights. So in order to access our services, everyone needs to call Entry Point, especially if folks want to access Families Moving Forward or UMD. Folks need to please call Entry Point. Even if folks are going to show up at Open Table, there's not a referral process that is required, but it's still always best to call Entry Point. So again, we're announcing when we're doing white flag on Mondays, and that information just goes out for the week ahead. That allows us to communicate with our overnight seasonal staff that are staffing that shelter. It allows us to communicate with Yates. And if the forecast ever changes within 48 hours, we can stand up a shelter as well. So again, we're announcing that on Mondays throughout the winter. This will go through March 31st. Check-in is from 7 to 8:30, and then we ask that folks check out around 7 to 7:30 the next morning. Yates has a on-site childcare facility, so by the time that teachers and young kids are arriving, we'll make sure that guests leave. A couple other things to note over the holidays. So over Christmas and New Year's, we're doing a block of hotel rooms. I realize that this is not ideal. Hotels can serve some folks and cannot serve some folks. This has been our plan since we've been planning starting back in September and October, just because we know that we cannot staff a shelter or host a shelter at a church over Christmas and over New Year's. So there's currently a referral process out. Hopefully you've received that information. We're currently accepting referrals for folks who are experiencing type 1 homelessness, both families with children and unsheltered individuals. And we'll be doing that check-in on Monday, the 23rd. And I also just want to highlight that the Durham Rescue Mission, while they're not a part of the continuum of care, they do also do overflow beds the same nights with the same parameters that we're following white flag. It's also really important to note that they do not have sobriety requirements on those nights. Folks just need to be receptive and friendly enough. So even if folks are drunk or under the influence of substances, they can still be dropped off at Durham Rescue Mission and stay for the night. Anytime they don't have a check-in window, again, as long as they're willing to kind of be a good, responsible neighbor. I realize that's a loose interpretation. So again, starting January 2nd, we'll be back to our regular white flag nights, doing the congregate shelter at Yates Baptist. Just looking ahead, we're doing white flag nights at Yates Friday, Saturday, and Sunday, because it looks like it's going to be really cold, hotels, and then we'll be doing our regular white flag through March 31st. I realize that's a very quick synopsis. There's some information on our website. Want to make sure that folks are receiving emails. I can drop my email in the chat to make sure that you are receiving those weekly emails and those weekly updates on Monday, because I know that can be difficult just with communication. So I want to make sure that folks are receiving those emails. That's a very high level information or just brain dump to you all, but I'm happy to answer any questions that folks have.
Thank you, Drew. And if you don't mind, would you add your website information to the chat as well? That will be helpful.
Absolutely.
Any questions? If not, we're going to turn it over to Ms. Addison for a point in time count update.
Good afternoon. I'll make this very brief. Our point in time is going to be on Monday, January 27th. We will be hosting at the PNC Club at the Durham Bulls Stadium. We have worked out the logistics for that. I believe that the invites should have gone out to some people that have already expressed they might want to be team leaders. So we started with those, and then the rest of the invites to sign up for the point in time should be coming out hopefully no later than next week. Russ, correct me if I'm wrong on that, but I think it's no later than next week. And we have been doing great work with the subcommittees. As you all know, this year we wanted to expand and make sure that the PIT count was very inclusive of a lot of subpopulations, including LGBTQ, Hispanic populations, excuse me, and youth and family populations. So we have some events that will be happening, more so service-based counts. So Freedom House has agreed to do a service-based count. So people that they encounter that are experiencing homelessness, they will be conducting surveys, as well as Recovery Innovations. HEART has agreed to provide 20 responders on the night of the PIT count to alleviate us having the police attend. They have direct access to 911. The El Centro, we finally were able to get in contact with them, so we're hoping to include them and get numbers from people that may be experiencing unsheltered homelessness who don't usually show up in our engagement, during our regular engagement, and that's covering the Hispanic population, the family. We are working with, or trying to work with Durham Congregations in Action to see if they have any churches that may be willing to host a parking lot for an overnight event for families or individuals sleeping in their cars. So they are working towards that. We are working very closely with Open Table Ministries to do a service-based count there during their free store on the Tuesday after the count. That is something that we have historically done. We will continue to do the breakfast meal at UMD that week. And then the last thing that we are working on is just some way to invite youth that may be experiencing homelessness. So we have So we have some ideas that may pan out. We're still working on that, but we actually will be meeting again at the top of January to firm things up. We have the final external PIT count meeting. So if you were in attendance to that today, we will have the final meetings each week during the month of January, just to kind of make sure we solidify all of the service-based counts, all of the agencies that have agreed to participate in conducting a count. And then we also have our trainings for the night of the count. We have those trainings beginning January 7th. So when you register, you will register on the Counting Us app. We will be using that again this year. When you register, it will ask you to register for a training. Each person who participates in the unsheltered count is required to do a training, and those trainings are virtual. And the last thing I believe is we are, no, that was the last thing. on my list. So I'll try to do that very quickly. If you have any questions, you can always reach out to me directly. I'm happy to answer any questions that you might have.
I
Ms.
did drop
Addison,
registration in the chat. We're doing registration in waves so we don't over register. So you have the link there, and we're already at 60 with just a few days of registration. So if you want to join us, I'd go ahead and kind of jump in the line quick.
are there any questions? Go ahead, Anthony.
Hi, everyone. Just a quick announcement on our upcoming annual homeless vigil. It is taking place this Saturday, December 21st at 6 p.m. It will be at the Central Park Pavilion. So I hope that those of you that are able will be able to come out. We will have not only sort of a memorial service and celebration of life, but we will offer refreshments and accept donations of winter-related items that can be provided to our neighbors who are unsheltered and in need. So I will post a flyer in this chat. I believe a flyer went out to everyone yesterday or day before, so you should probably already all have it, but I just wanted to point it out in case you hadn't seen it, that event is happening this Saturday evening, and we hope to see as many of you as available there with us. Thank you so much.
Anthony, there's one question in the chat about transportation for the event on tomorrow, Saturday.
We have not, thank you, Chris. We have not provided formal transportation in the past. I think that it's an interesting thing to consider. We did get the word out to the shelters, but there are sometimes limitations because shelters have curfews and things, and they're in the mode of operating their businesses. So, you know, it will depend on what their capacity is, whether or not transportation can be made available. But thank you for bringing that up. It is something for the committee to consider.
Thank you so much. Are there any other announcements from HSAC or COC members? If not, at the end of the agenda, there is reminders about the executive committee meetings, which is the first Friday, January 3rd from 10 to 11:30. Policy and planning next meeting is January 13th from 10:30 to 12. And then the next performance management committee meeting is the second Tuesday, which is January 9th from 11 to 11:30. And then our full HSAC meeting will be January 15th from 3 to 4:30. And thank you all for your time. We apologize about going over, but I hope everybody have a Merry Christmas, and we'll see you in 2025.
Merry Christmas as well.
Merry Christmas.
Merry Christmas all.
Hey, Ebony.
Happy holidays.
I think I was supposed to vote to end the meeting, right?
No, you can adjourn.
Okay, the meeting is adjourned.
Thank you, ma'am. Have a good one.
Bye-bye.